Thank you. Joining us now, Florida Congresswoman Laurel Lee. What is your prediction? What does the fight look like ahead with this big, beautiful bill and concerns from millions of Americans about health care and how Congress tackles this big, beautiful plan when it comes to Medicare, Medicaid?
Well, look, the big, beautiful bill contemplates so many of the things that Republicans went out and campaigned on and that the American people want us to address. First off, we're tackling fraud, waste, and abuse wherever we find it, both in our review of government programs and in the work that's happening with DOGE. Republicans are committed to securing and strengthening the Medicaid program, and that is exactly what we will do by identifying where there are places that waste and abuse are occurring. So the other things that will be part of this package that we know we are working on that we're going to deliver for the American people are increasing efficiencies, increasing the delivery of the types of services and outreach that the American people need, while cutting out the waste of taxpayer dollars. We've all heard the examples about programs overseas and empty government buildings here at home. There are so many places that we can cut while also encouraging economic growth.
Right. The president laying out a number of those wasteful spending areas in his speech this week. So do you support the package to codify DOGE's moves on the cuts so far?
I do believe we have a great opportunity for Republicans in Congress to partner with DOGE. Just this last week, Elon Musk came and spoke to a number of us in Congress about some of the things that he's finding and places that we can cut back and make sure that we're all being good stewards of the American taxpayer dollar. So what we can do is work together and take those things that DOGE is identifying as potential cuts, review them in Congress and codify them. And that's really a way that we can make lasting change. What's really great to see is that DOGE is harnessing technology to look at the vast amount of information and data and physical resources, buildings that we have that are on the government's ledger, essentially, and really assimilating that information, cutting through it, and identifying the places that we want to take a second look and look deeper and see if it's something that's a program that's defunct, an employee who's no longer with the federal government, places where we can make those cuts while also keeping the services and the people that are essential. Look, I was a longtime employee of the U.S. Department of Justice, so I absolutely know there are government workers who are essential, that are keeping our communities safe and our infrastructure strong. So what we want to do with DOGE and Congress is make sure that we find the difference, cut the things that should be cut, keep the things that help the American people.
I think as the president put it to reporters, find the good people, which was his directive to his cabinet members, one of which I spoke with this morning, Education Secretary Linda McMahon. This is a different situation, Congresswoman. This isn't looking to look for areas to cut. This is shut down the department altogether, a directive that the president has promised. Here's part of our conversation on that difficult task.
What President Trump wants to do is to take the bureaucracy out of education. He believes, as do I, that the best education is closest to the student, that parents, that teachers, that school administrators in the local areas know what's best. There is no one-size-fits-all for education. And what I hope the Education Department will be able to do as we are paring down and preparing to turn over all control to the states is that we can provide them with tools to help them. We can provide them with research. We can give them information on best practices that is working in many states already.
Are you prepared to do away with the Education Department, and how does that impact students in your state if their education is left up to the state? Is a state like Florida equipped to handle that adequately?
Well, Florida certainly is. And oftentimes the government that works best is the one that's closest to the people. And I think what the secretary was saying there is so important, that the government can still help support and aid education and make sure that the programs that we all care about are funded and supported, and they're getting the resources and the guidance and the best practices they need without top-down mandates from an incredibly expansive bureaucracy that sometimes can be out of touch with what's happening in our local community. So we believe in empowering the parents and the students and finding the ways to keep the best of those programs, but also not create this unnecessary bureaucracy that serves the union more than it serves the parent and the child. So we're very interested in seeing what the secretary and the administration propose, where some of these things may be housed, where some of the essential programs could be moved, how we can continue to support the states in the ways that are necessary, but move that process out of Washington where we can.
Finally, Congresswoman, you are on the Make America Healthy Again caucus, and one issue that's been in the headlines as of late is the measles outbreak. There was a second person that reportedly died from the illness this month. Your state has its first reported case. What is your message about this outbreak and how we address it?
Well, I think that the MAHA movement, if you will, is really about empowering Americans to make sure that they have transparency from their government, accurate and reliable information, and the tools and resources that they need. In this case, access to vaccines, access to understanding how those vaccines are made, what we know about them, what the research shows, and the public health information and support to make sure that we're keeping our kids safe. The MAHA approach really looks at the whole of health and wellness that includes everything from vaccines and pharmaceuticals where we know they work and they're proven and they're safe, but also looking at what we eat, how we take care of our bodies, the things that we're putting into our bodies, and trying to work on education, transparency, and prevention as opposed to just addressing disease. And so I think Secretary Kennedy has really been out front and leading on making sure that he's touching all of those pillars, making the resources people need available, but also ensuring that they're getting a whole new level of transparency and openness from the government when it comes to health-related information.
Congresswoman Laurel Lee, thanks for your time this morning.
Great to see you.
You too.